Hi, my name is Diego Vasquez, and I am a psychologist and a researcher at Socios and Salud, Peru. Together with colleagues from the Peruvian National Institute of Child Health, the University of South Florida, and Harvard University, I recently published our paper, Building EVA, a tutorial for the development of the digital mental health chatbot for adolescents living with HIV in the Journal of Medical Internal Research, JMIR. Adolescents living with HIV often experience depression, stigma, and difficulties accessing mental health support. EVA was developed as a low-cost chatbot designed to provide mental health information, practical self-help activities, and guidance for seeking professional support in a youth-friendly and confidential way. This was possible using a human-centered design approach, and this tutorial explains how the chatbot was developed together with adolescents living with HIV through iterative co-design sessions with a youth advisory board. An important aspect of this project is that EVA was developed by healthcare providers and researchers without formal training in software development, showing that accessible digital mental health tools can be created in low-resource settings together with young people. Finally, this article shares practical lessons and key development steps that may help other teams interested in creating digital mental health tools for adolescents and other vulnerable populations. We choose to publish in JMIR Publications because it is a leading journal in digital health research and provides a strong visibility for innovative global mental health intervention and practical digital tools designed to expand access to care in underserved communities.